Hi there, my name is Dr. Chibuki and I head the medical operations at Baby Bliss. I'm here to show you pointers on how to select a hospital for your antenatal care and delivery. One of the very first things a woman should consider is proximity to either her house or where she works. It's important for a mother to choose a hospital that is very close to her house if she's a stay-at-home mom, so that in times of antenatal visits, she don't have to travel so far to get her antenatal done. Also to consider, a point to consider is if she falls in labor at very odd hours and she's not able to transport herself conveniently from home to the hospital. However, if you are a career woman, it's nice to have your antenatal somewhere close to your office. You might want to consider having this option so that you can, take a 2-hour break from the office and have your antenatal checks done instead of having to go back home or to take the whole day off from work because you want to have your antenatal visits. Another very important point to consider is costs. Cost is very important. It's a major factor to determine where you want to register for antenatal and have your bundle of joy. You would want to choose a hospital that is just the right amount for you. We at Baby Bliss have hospitals that offer antenatal for as low as 15,000 naira. Oh yes, you heard me right, 15,000 naira. And should you want to have your hospital, your birth or antenatal at more expensive facilities, we have the options where you can pay in installments. You can pay monthly in bits. It's also important to consider that your hospital of choice has the expert care that you need. What do I mean? You want to ensure that not only do they have qualified midwives, but they have consultant obstetrics and gynecologists on ground. Other specialists include neonatologists, who are pediatricians that specially care for neonates who are babies between 0 to 28 days of life. This is very important. You also want to consider if the hospital has other specialists like endocrinologists who can manage you if you have gestational diabetes, which is very common these days, or in other specialists. It is important that you inquire if the hospital that you want to register for antenatal or birth your baby in have these specialists. How equipped is your hospital of choice? You might want to, for whatever reason, say cost or proximity to your home, choose a hospital that is not well equipped, and this is fine. However, you want to make sure that in cases of eventualities, say there's an emergency, this hospital has an ambulance to move you or your baby to where they can get expert care. It's also important to find out if these hospitals have incubators, should you fall into premature labor and have a premature baby. It's important to find out if they have a neonatal intensive care unit. It's important to know if the hospital has an intensive care unit for you should you have any complication during cesarean section or vaginal delivery. Another reason is usually privacy. Some facilities don't have very exclusive private birthing suites. So it's usually an open ward with beds. So they'll like to, give the other mothers some privacy and may not allow your birthing partner to be present with you during labor. So it's nice to clarify this if this is very important to you. Having watched this video and listened to the points I have listed, I hope you're in a better position to make an informed decision on what hospital to choose to deliver your little one. Bye for now.